Sugar is a surprisingly effective way to stop a wound from rotting. It sounds like something a frantic grandmother might tell you while you're bleeding over the kitchen linoleum, but if you pack a deep gash with granulated sugar, it actually draws out the moisture that bacteria need to survive, effectively mummifying the infection before it can start. Now, take a second and let that sink in. We live in an era of triple antibiotic ointments and laser-guided sutures, yet one of the most effective ways to save a limb in a pinch is sitting right next to your coffee pot. This realization, the fact that the distance between a primitive fix and a modern miracle is often just a matter of branding, is the key to understanding how our ancestors survived long enough to become our ancestors. Think about the last time you got a paper cut. You probably hissed, stuck your finger in your mouth, which, as we'll see, is actually a very old biological reflex, and went looking for a Band-Aid. We treat minor injuries as a nuisance, a temporary glitch in our personal hardware. But for a human living 30,000 years ago, that glitch was a high-stakes gambling match with the universe. Without a pharmacy, a bad scratch from a thorn or a jagged piece of flint wasn't just an ouch moment, it was a ticking clock. If that wound turned red, swelled up, and started to smell like old laundry, you were effectively a dead man walking. And yet, here you are, reading this, which means your great-great-great times 1,000 grandparents were exceptionally good at not dying. They weren't just lucky, they were observant, and they were desperate, which is the ultimate recipe for scientific discovery. Have you ever wondered why you have an instinctive urge to clean a wound? It feels like common sense now, but for a long time, the why was a complete mystery. We used to think ancient medicine was just a collection of spooky chants and lucky charms, but the more we look at the archaeological record, the more we realize that our ancestors were running the world's longest-running clinical trial. They were the original biohackers, using the forest as their laboratory and their own survival as the data set. And honestly, some of the solutions they came up with make our modern medicine look a bit unimaginative by comparison. A realization that likely came at a very high cost in blood, but still. To understand how they did it, we have to go back further than humans. We have to look at our cousins. Chimpanzees don't have medical degrees, obviously, but they do have an incredible grasp of self-medication. Researchers like Michael Huffman from Kyoto University have spent decades watching chimps in the wild, and what they've found is mind-blowing. When a chimp is feeling sluggish or has a stomach bug, it doesn't just eat whatever is nearby. It goes out of its way to find Vernonia amygdalina, a plant that tastes absolutely bitter and has zero nutritional value. But it's packed with anti-parasitic compounds. They chew the pith, swallow the juice, and a day later, they're fine. Even more relevant to us, chimps have been observed catching insects, crushing them, and applying the paste to their own wounds and the wounds of their community members. They aren't doing this because they read a textbook, they're doing it because it works. This suggests that the doctoring instinct isn't something we invented alongside the wheel. It's part of our deep evolutionary software. We were treating wounds before we were even human. But once we did become human, we took that instinct and turned it into an art form. Imagine you're a Neanderthal living in the Shanidar cave in modern-day Iraq about 60,000 years ago. You've taken a nasty tumble while hunting, and your leg is a mess. According to the research of Ralph Seletsky, who excavated the site in the 1950s, your community wouldn't have just left you to rot. One of the skeletons found there, known as Shanidar 4, was buried with clusters of pollen from at least 7 different medicinal plants. We're talking about yarrow, cornflower, and groundsel, plants that are still used in traditional medicine today for their anti-inflammatory and antimicrobial properties. Which, if you're keeping track, means Neanderthals had a better grasp of pharmacology than most of us do when we're staring at the aisles in a CVS. Yarrow is a particularly cool example. It's known as Achillea millefolium, named after the legendary Achilles, who supposedly used it to treat the bleeding wounds of his soldiers. It contains alkaloids that actually help blood clot faster. Our ancestors figured this out by watching what happened when they pressed different leaves against a cut. They didn't need to know what an alkaloid was. They just needed to see the blood stop flowing. This kind of empirical observation is the bedrock of everything we know today. Now, let's talk about the gooey stuff. If you've ever had a sore throat and reached for a spoonful of honey, You're participating in a medical tradition that is at least 5,000 years old. Ancient Egyptians were obsessed with honey, and for good reason. In the Edwin Smith Papyrus, a medical text from around 1600 BCE that likely contains knowledge far older, honey is listed as a primary ingredient for wound dressings. And here's the kicker, it actually works. Honey is a freak of nature. It's so high in sugar that it sucks the water out of bacteria through osmotic pressure, basically turning them into tiny, shriveled raisins. It also produces low levels of hydrogen peroxide when it touches a wound. The Egyptians didn't have microscopes to see the bacteria dying, but they could see that a honey-soaked bandage prevented the foul smell of infection. They were practicing germ theory for millennia before Louis Pasteur was even born. It's a bit humbling to realize that a bee's vomit is more sophisticated than some of our early 19th century hospitals, but that's the reality. But honey was just the beginning. Our ancestors were remarkably resourceful when it came to closing a gap in the skin. Have you ever walked through a spider web and spent the next 5 minutes frantically brushing it off your face? Well, in ancient Greece and Rome, you would have been encouraged to keep that web. Spider silk is naturally rich in vitamin K, which is essential for blood clotting. It also has an incredibly fine structure that provides a physical scaffold for new skin cells to grow across. Soldiers in the Roman legions would often carry a wound kit that included spider webs and vinegar. The vinegar acted as a mild antiseptic, creating an acidic environment that bacteria hate, and the silk acted as the bandage. It was a low-tech, high-efficiency system that saved countless lives on the battlefield. Of course, sometimes a bandage isn't enough. Sometimes, the wound is so bad that you need to get aggressive. This brings us to one of the most stomach-churning, yet brilliant, ancient techniques, the ant suture. Imagine you're in ancient India or the Amazon basin, and you have a deep, gaping wound that needs to be held shut. You don't have a needle and thread. What do? You find some large soldier ants, specifically the ones with massive mandibles. You hold the edges of the wound together, and you let the ant bite across the gap. The moment the mandibles lock into place, you twist the body of the ant off, leaving the head behind. The jaws stay locked in a death grip, acting as a perfect, biodegradable staple. This technique is described in the Sushruta Samhita, an ancient Sanskrit text on medicine, and it was used for centuries. It's elegant, it's effective, and it's undeniably metal. But what if the injury is internal? What if the wound is a crushed bone or a limb that's gone black with gangrene? For a long time, historians assumed that ancient humans just died from things like that. We had this image of the caveman as a primitive brute who wouldn't know the first thing about surgery. But then in 2022, a discovery was made in a cave called Liang Tibo in Borneo that changed everything. Researchers found the skeleton of a young person who lived 31,000 years ago. Their left foot and lower leg had been removed. Now, you might think, maybe a crocodile got them? But no. Dr. Tim Maloney and his team at Griffith University analyzed the bone and found something incredible. The cut was clean, precise, and most importantly, the bone showed years of healing afterward. This wasn't an accident, it was a successful surgical amputation. A feat that requires an understanding of veins, arteries, and infection control that we didn't think existed until very recently. This person lived for at least 6 to 9 years after the surgery. Think about the logistics of that. Someone 31,000 years ago had to know how to stop the massive bleeding of a leg amputation, likely using pressure and plant-based tourniquets. They had to keep the wound clean for months in a tropical environment. And the community had to value this person enough to carry them, feed them, and protect them while they recovered. It shatters the idea that ancient life was nasty, brutish, and short. It was actually sophisticated, compassionate, and medically daring. Then there's the head. If there's one ancient medical practice that everyone knows, it's trepanation, the act of drilling a hole in someone's skull. We've found thousands of these skulls all over the world, from Peru to France to Russia. Some are over 7,000 years old. For a long time, we thought this was just some weird ritual to let the demons out. And sure, maybe there was a spiritual component to it. But look at the evidence. Many of these skulls show signs of head trauma right next to the hole. When you get hit in the head, your brain swells. Since your skull is a hard box, that swelling has nowhere to go, which leads to brain damage and death. By drilling a hole, ancient surgeons were relieving that pressure. A procedure, parenthetically speaking, that we still do in modern trauma wards today, though usually with better drills. The survival rates for ancient trepanation are shockingly high. In some South American sites, over 80% of the skulls show signs of bone healing, meaning the patient didn't just survive the surgery, they lived for years afterward. Compare that to the American Civil War, where the survival rate for many surgeries was barely 50% due to the horrific lack of hygiene in modern hospitals. Our ancient ancestors, with their obsidian blades and herbal washes, were often safer than soldiers in the 1860s. So, how did they know all of this? How did they pass it down without a Google search or a peer-reviewed journal? The answer is the specialist. Every group had one: the shaman, the wise woman, the healer. These weren't just people who knew a few songs. They were the keepers of the tribal database. They were the ones who spent their lives watching which berries made people puke and which moss stopped a wound from oozing. This knowledge was precious, and it was transmitted with extreme care. When writing finally appeared, we started to see these oral databases being backed up onto clay and papyrus. The Edwin Smith Papyrus, which I mentioned earlier, is a masterpiece of clinical observation. It's not a book of magic spells, it's a trauma manual. It lists 48 different cases, starting from the head and working down to the spine. For each case, it gives a physical exam, a diagnosis, and a treatment plan. It even has a category for an ailment not to be treated, which is essentially the world's first triage system. The author was a realist. They knew that some wounds were beyond their help, and they documented that too. By the time we get to the Greeks and Romans, wound care had become a formal science. Galen, the famous Roman physician, got his start as a doctor to the gladiators. If you want to learn about deep tissue wounds and massive hemorrhaging, there is no better classroom than the Colosseum. Galen realized that keeping wounds moist was better for healing than letting them dry out, a concept that modern medicine actually forgot for a while before rediscovering it in the 20th century. He used clean linen soaked in wine to dress wounds. Why wine? Because wine contains alcohol and tannins, which act as antiseptics. Again, he didn't know why it worked, but he saw that gladiator wounds treated with wine didn't turn into a septic nightmare. Which is a pretty solid reason to always keep a bottle of Merlot in your first aid kit, even if it's just for moral support. Have you ever wondered why we use the term clinical to describe something cold and objective? It's because the ancient doctors learned that to save a life, you had to separate the person from the injury. You had to look at a gaping hole in a human chest not with horror, but with the eye of an engineer. This shift in perspective, from seeing an injury as a curse to seeing it as a mechanical problem, is one of the greatest leaps in human history. But there's a catch. For every brilliant discovery, there was a disastrous mistake. Ancient medicine was a double-edged sword. For every honey dressing that saved a life, there was a treatment involving animal dung that likely caused a fatal case of tetanus. In ancient Egypt, some wound poultices called for fly specks or crocodile excrement. The logic was often based on sympathetic magic, the idea that something powerful or disgusting would drive the spirit of the disease away. They were incredibly close to the truth in some ways and hilariously, dangerously wrong in others. It was a chaotic, trial-and-error process where the stakes were literally life or death. Yet, even the wrong treatments tell us something about our ancestors. They were never passive. They never just sat there and watched someone bleed out. They were always trying something. They were packing wounds with resin, covering them with eagle feathers, washing them with beer, or searing them with hot irons. Cauterization, burning a wound shut, was a brutal, agonizing process, but it saved people from bleeding to death. It was a choice between the pain of the fire or the silence of the grave. They almost always chose the fire. This brings us to a bigger realization. We often look back at the past and feel a sense of superiority. We have antibiotics. We have sterile operating rooms. We have anesthesia. But our ancestors were playing the same game as us, just on hard mode. They had the same brains, the same curiosity, and the same drive to survive. The only difference is the tools. If you took a modern trauma surgeon and dropped them into a forest 10,000 years ago, they would likely be useless. But if you took an ancient healer and brought them to a modern ER, they would recognize exactly what's happening. They would see the sutures and recognize their ant heads. They would see the bandages and recognize their spider webs. They would see the aspirin and recognize the willow bark they'd been brewing into tea for centuries. Willow bark is a perfect example of this continuity. For thousands of years, people across the globe, from the Sumerians to the indigenous tribes of North America, knew that if you chewed on willow bark, your pain went away and your fever dropped. It wasn't magic. Willow bark contains salicin, which our bodies convert into salicylic acid. In the late 1800s, the Bayer Company figured out how to synthesize a stable version of this, and they called it aspirin. We didn't invent the cure for a headache, we just figured out how to put it in a convenient little white pill. A pill that owes its existence to a nameless person 4,000 years ago who decided to gnaw on a tree branch because their tooth ached. The more you look at the history of wound care, the more you realize that medicine isn't a straight line of progress. It's a messy, circular journey of observation, forgetting, and relearning. In the Middle Ages, European doctors actually went backward. They started believing that pus was a good sign, calling it laudable pus, and they would intentionally irritate wounds to make them ooze. They forgot what the Greeks, Egyptians, and even the cavemen knew, that cleanliness and moisture are the keys to survival. It took us hundreds of years to get back to the level of hygiene that a Roman gladiator doctor took for granted. This wound man concept, a common illustration in medieval medical texts showing a man covered in various injuries, reminds us that humans have always been fragile. We are essentially soft bags of water and bones walking through a world full of sharp edges. Our survival is a miracle of engineering and community. Because that's the other half of the story, none of these treatments work in a vacuum. You can't perform surgery on yourself. You can't change your own bandages if you're unconscious from a fever. Every healed bone we find in the archaeological record is proof that someone else was there. Someone else brought the water. Someone else crushed the herbs. Someone else stayed awake through the night to make sure the fire didn't go out. A social safety net that was, parenthetically, the most effective medicine ever invented. We tend to think of medicine as something that happens in a sterile building with white coats, but medicine is actually a social contract. It's the decision that an injured person is worth the effort of saving. Whether it's a Neanderthal sharing their yarrow or a modern person donating blood, the impulse is the same. We are the species that heals. We are the ones who look at a broken body and say, I can fix this. So where does that leave us? It leaves us with a profound respect for the primitive. We are the beneficiaries of a 100,000-year-long relay race. Every time you use an antiseptic wipe, you're using a refined version of ancient wine. Every time you take an aspirin, you're chewing on a willow branch. Every time you get a stitch, you're using a high-tech version of an ant's jaw. We haven't replaced the wisdom of our ancestors, we've just polished it. It's easy to feel safe in our modern bubble. We think we've conquered nature, but the truth is, we're still just as vulnerable as the guy in the Borneo cave 31,000 years ago. We're still fighting the same bacteria, the same infections, and the same fragility. The only thing that's changed is that we've gotten better at hiding it. We've outsourced our survival to a complex system of pharmacies and hospitals, but if that system ever glitched, we'd be right back in the forest, looking for yarrow and spider webs. And honestly, we'd probably be okay because that knowledge is literally baked into our history. If this kind of deep dive into the hidden history of our species fascinates you, you're going to love what I've put together for the next phase. I've spent the last year developing a comprehensive course called The Secret Lives of Ancient Humans. It's 10 modules and over 3 hours of content where we go way beyond what I can cover here on YouTube. We look at what they actually feared, how they communicated across vast distances before language as we know it existed, and the incredible, often terrifying predators that hunted them. There's even an exclusive PDF guide included that maps out ancient survival techniques you can actually test. If you want to join a community of people who look at history a little differently, click the link in the description. I'd love to see you in there. Think about that paper cut again. The next time you see a tiny drop of blood on your finger, don't just reach for the Band-Aid. Take a second to look at it. That blood is clotting because of a biological process that your ancestors spent thousands of years trying to understand. You are carrying around a biological masterpiece that was refined in caves, on battlefields, and in the huts of healers who had nothing but their eyes and their wits. Every breath you take is possible because someone 40,000 years ago didn't give up on a limb that smelled like death, yet the irony is, you're currently more likely to die from a hospital-acquired infection than they were from a jagged stone cut. We've built a world where we've traded the dangers of the forest for the dangers of our own making, but the spirit of the healer remains the same. We are a species defined not by our wounds, but by how we treat them. We are the survivors, the stitchers, and the dreamers who looked at a hole in a skull and saw a way to save a life. The story of ancient medicine isn't about how much they didn't know. It's about how much they managed to figure out while the world was trying to kill them. It's a story of grit, observation, and a refusal to accept defeat. And that, more than any antibiotic, is why we're still here. If you have a story about a weird home remedy that actually worked, or a family tradition that sounds like it came from an ancient papyrus, I'd love to hear it in the comments. We're still adding to the database after all. And if you want to keep exploring these rabbit holes with me, you know what to do. The past is never really dead, it's just waiting for someone to notice it. The most unsettling thing about this entire journey into the past isn't the antheads or the skull drilling. It's the realization of how thin the ice really is. We treat our modern medical system as an invincible fortress, a permanent shield against the chaos of nature, but history shows us that knowledge is a fragile thing that can be lost in a single generation. You are currently living in the only 200-year window in human history where a simple scratch isn't a potential death sentence. But here is the cold, undeniable fact that should keep you up tonight. The hair from the cave wasn't just currently evolving faster than our ability to create a new antibiotics, in the life of a visionary. Which means we are rapidly approaching a day where your modern doctor will have no more power to save you from an infected wound than a Neanderthal had 60,000 years ago. A color that represented life, the only thing that will matter is how well you remember the honey and the willow bark. They didn't just give us their hair. Your comfort is a historical fluke. We were never just animals patiently waiting for its turn to be the pharmacy again. We were always something much stranger and much more beautiful. We were the species that decided to look at the dark and find the light, even if we had to grow it from the ground. And that, more than any tool or city, is what truly makes us human.